Hey guys, Dr. Oscar with Revolution Health Center, Murfreesboro, Tennessee. Continuing our conversation on neck pain and what to do about it. And today I wanted to share with you, because I get a lot of questions like, well, what specifically do you do in the office to help out with neck pain? And a lot of times what we found is with neck pain, a lot of it has to do with just weakness in the muscles of the neck itself. If muscles are weak, they have to work extra hard to keep you upright. And of course, this means that you're overworking these muscles, these weak muscles. And an overworked muscle does have a tendency to get tired, get sore, get inflamed, and get achy. Now, there's other factors involved, and that's where the chiropractic adjustments come into place to stabilize your spine, which your muscles are attached to. But having weak muscles is a big part of neck pain as well too. So part of the plan is to, as we're adjusting and correcting and helping take pressure and tension off your spine and nervous system, creating strength to hold and maintain the correction as well too. I'm fond of the idea if we're going to stabilize your spine, let's create strength to get some long-lasting results as well too. That way we're not going through this game of being in pain, getting some relief, leaving it alone, being in pain again, getting some relief, and then leaving it alone again. And a lot of times what happens is things just get worse and worse and worse over time as you're kind of rebounding from good to bad to good to bad. Let's keep this trajectory of let's get good, let's get better, and let's just keep on getting better every day. So one of the things that we do in the office is, depending on what we find on x-rays, and also just what we found in our evaluation, is where do you need strength? Where do you need specific strength in the muscles in your neck? And one of the tools that we use is what we call just these head weights, forward head weights. And what these allow you to do, us to do is to be very specific in placement of weights on your head. And I'm going to look silly doing this. I tell everybody, you look silly doing it, but it's really worth it. And what we'll do is have you wear a very specific set of head weights that are, like I said, dependent on the evaluation and your x-rays, that will then start to strengthen the appropriate muscles in your neck to start creating strength, so that as we unlock your spine and your nervous system, we're creating strength to hold and maintain the correction as well too. And we'll do these head weights on vibration platforms. And what we have here is a vibration platform that's a very powerful tool. I'll turn it on here real quick. That vibrates at very specific frequencies that the nerve endings in your muscles respond to. So this combination of using the appropriate head weights and the vibration therapy after your adjustments begins to train strength into the muscles to help you hold the adjustment better, hold the adjustment a lot longer, and create a long-lasting shift and change that will then greatly reduce the tension and stress that you have in your neck, across your shoulders, that then lends to pain, discomfort, and a lot of times is associated with other things like headaches and sinus pressure and congestion and pain down even into your arms and hands, and numbness and tingling as well too. So yeah, I just wanted to share that today. Like I get, what do you do specifically in the office that you help neck pain patients with? And this is a very powerful tool. Head weighting systems that are really dependent on how you present. And we like to be as specific as we can with that as well too. So yeah, if you or somebody you know is experiencing discomfort and is looking for help and maybe wants to be this specific and actually get on top of it, please click on the link below. That'll bring you to our landing site where you can fill out the information, contact information, name, number, email address, so we can then connect with you and find a time. I'll have my team members connect you and find a time where we can sit down and do an evaluation, a very complete evaluation, that will include a set of x-rays if they're necessary as well too, and an adjustment to be able to sit down and say, hey, this is what we've got to do to get you stronger, to get you healthier, to start reducing some of that pain, get some relief and some results that'll then last you a lifetime as well too. All right guys, see you on the next video.